Hi everyone, I'm Michelle Coombs. I'm a physical therapist. Today we're going to be talking about elbow rehabilitation. Specifically, we're going to be covering ulnar collateral ligament early rehabilitation. The ulnar collateral ligament we also will refer to as the UCL. Now, this is the commonly repaired ligament in the Tommy John surgery. It's known in sports, particularly the baseball world, but other types of athletes also can get this injury as well. Let's go over a little bit about the anatomy of the UCL. The UCL is located in our medial elbow, so the inner elbow. It provides medial stability to our elbow. So if you find the medial epicondyle, which is this kind of bump near your funny bone or the place that you hit and then some of your fingers go numb, that's the medial epicondyle. And then you think about the bony area that you think about as your elbow. It's kind of located between those areas. It spans that region. There are three bands of the UCL: the transverse band, the anterior band, and the posterior band. The anterior band is our primary stabilizer against a valgus stress. So if you think about typically a baseball athlete or a pitcher, they're trying to throw the ball. In this layback position, the elbow is going to have that valgus stress put on it, which can many times stress that UCL. So this is commonly injured in athletes that have repetitive overhead throwing, such as baseball, but other athletes can get injured as well. Let's go over the muscles in the area. So the muscles that span this kind of medial forearm elbow area, they're going to help to reinforce the stability of that area when the ligament might be compromised. So that's something that you'll notice in a lot of rehab is when static stabilizers are compromised. Static stabilizers are things like the ligament, the capsule, the labrum in certain joints. When those are compromised, we can definitely work on dynamic stabilizers, which are the muscles in the area. So the muscles that will span and cover this area are our wrist flexors, okay, our finger flexors, and our pronator teres. So pronation is when we turn our palm downward. So you have two pronator muscles. One is located up here and one is located closer to the elbow, which is the pronator teres. So that's one of the ones that we're going to focus on. When people have an injury to their UCL, they might notice swelling, tenderness, pain, feeling like the medial elbow is unstable. They might have difficulty with gripping activities or any activities involving pronation, sometimes like turning a key to open a door or any throwing activities. So the first exercise is going to be a wrist flexor strengthening exercise. Okay, this is a demonstration of the wrist flexor strengthening exercise. I'm using a water bottle. If you have a dumbbell, you can use a dumbbell. But this is just to show that you can do this exercise even if you don't have dumbbells. I'm stabilizing my forearm on a table just so that we're really isolating the movement at the wrist. And what I'm going to do is I'm just going to slowly lower and extend my wrist and then curl it back up. Right? And you can do partial range of motion if that's more comfortable, but eventually you want to be able to do this with a full range of motion. And you can gradually add weight to it. And I would probably try it at 10 to 15 times each set and 2 to 3 sets a day, at least 3 times a week. The second exercise is going to be finger flexor strengthening exercise. So you have multiple muscles that also help to flex your fingers. And so these also pass the elbow region and they can help to reinforce the stability in the elbow area. Okay, here's a demonstration of the finger flexor strengthening exercise. I'm just using a little squishy ball, but if you have a stress ball or a some therapy, that can work too. If you want to work on different types of grip strength, you can also hold a weight plate or a kettlebell, either from the top or the bottom. Those will also work on some intrinsic hand muscles. So here, there are a few different ways that we can do this exercise. You can either squeeze and kind of into a grip and hold it for, let's say, 15 to 20 seconds at a time, and then relax, or you can just do like little squeezes. If you're going to do little squeezes, then maybe try, 15 times, 2 to 3 times a day, at least 3 times a week, and see how that goes. And again, I am stabilizing my forearm on a sturdy surface or a table just to make sure that I'm not having any extra movements elsewhere in my arm. The third exercise is pronator teres muscle strengthening. So like I said before, the pronator muscle that's located near the elbow is the pronator teres. And so typically the pronator teres, it's going to help you with pronation. However, for this type of strengthening exercise, usually we're going to be holding either a dumbbell or maybe a hammer, a water bottle. We're actually going to be controlling the movement of supination, which is the opposite motion. But because we are controlling supination, that is actually done by the pronator muscles. So this is a demonstration of the pronator teres strengthening exercise. It'll also work on your pronator quadratus, but right now we're just targeting the pronator teres since it's near the elbow. I'm using a hammer just because for me, one end being heavier just creates more of a challenge, but you can also use a water bottle, a dumbbell. There are various things that you can use. And depending on where I hold the item, if I'm holding closer here, of course, it's going to be easier. But if I hold it at the bottom, then as I perform controlled supination, which uses my pronator muscles, it's just going to be more demanding. Okay, so I'm going to start here at the vertical position, and I'm going to turn my palm upward as I control how fast the hammer goes down. Okay, and I can do that 10 to 15 times. Try for 2 to 3 sets a day, at least 3 times a week. And as you can see, I'm still stabilizing my forearm on a table just so I'm isolating that movement. So it's important to remember, we want to make sure that we are maintaining our mobility and strength throughout our lifetime. Our body adapts to the stress that we put on it. So if we stop working on these things, the capacity of those tissues will indeed decrease again. So keeping our mobility and strength is like having good hand hygiene. This is an example that I use a lot. Even though it's still possible to get sick, even with good hand hygiene like hand washing, it's less likely that it'll happen. And so if you upkeep your mobility and strength, it's still possible that you can get injured, but it's going to be less likely because you've already improved the capacity of the tissues in that area. Later stages of rehab, which we're not going over in this video, but they are going to incorporate that grip, wrist, forearm strength into functional activities. And those functional activities are going to differ from person to person, depending on what they need to do in their daily life, what their hobbies are, what their sports are. Anyway, I hope you enjoyed the video. If you did, like it and subscribe. We'll see you next time. Bye.